I'm interested in knowing, first of all, the Premier who declared open for summer, open for good back in July, last night at that address to Albertans saying that was premature, admitting that and apologizing. What did you think at hearing that?
I think that was political theater. This is the same man who called me a Twitter doctor, who looked at people with expertise and denigrated us, who basically took any criticism and demonized those people. And that's what he did so that he could open this up so he could have his stampede.
And Stampede, as you said, opened for summer, and the Stampede did take place. And of course, we know what has flowed from that, the record cases and the crisis in the hospitals and the measures to counter that he announced last night. Everything from the vaccine passport, not calling it that, mandatory work-at-home orders. As you look at the measures that have been announced and are enacted as of today, what effect do you think that they will have?
Well, what terrifies me is the fact that we're too late. We've been launched into space. We're still accelerating. Even if we apply all of these measures, it's going to take 2 weeks for us to see these numbers start to plateau. Meanwhile, our intensive care unit is full. It is fuller than it has ever been. And it is full of young people who are literally dying as a result of this. And we've lost the moderate middle. These people are truly shocked when they find out that they have COVID. They can't understand why they are sick. And they replace the empathy that we saw in the first wave with anger and confusion. This is even discounting some of the numbers that never make it to the unit. I was in the middle of the emergency department the other day resuscitating a young woman who was a single mother of 3 children, and she didn't even make it to the unit. These people are dying in the community undocumented. This is a tragedy that was completely preventable. Every time I'm here, I say the same thing. The medicine here isn't hard. The politics is difficult, but with leadership, we can avoid it.
When you talk about nothing going to take place for at least 2 weeks, and I'm even thinking part of this push is to get more Albertans vaccinated. Getting that number and getting to have any efficacy from vaccination is going to take even longer than that. But if you're looking at nothing until at least 2 weeks, what's going to happen then, Dr. Markland, in this short term, like right now?
We're talking about transporting people to other provinces, medevacing them, distributing them possibly to Calgary, where our numbers are a little lower, and maybe further afield. But there are stresses in the rest of the country. We'd have to look at Ontario and BC. That is a challenging thing, to transport a patient that sick for that distance. That has huge risks associated with it. In the interim, we're discussing triage. We literally are talking about what happens when we hit these numbers, because we don't physically have the staff to look after the crazy number of numbers that are coming at us.
You've mentioned what you've noticed in terms of patients in the hospital, how they're viewing COVID, and we've talked often about how charged this issue has become, particularly in Alberta. Can you talk about, it's a political issue now, but it's had a real bearing. We've seen the protests outside hospitals. You've even talked about your own personal experience being the target of people who don't like what's happening, don't believe in what's happening. Can you just share, in case anyone has missed some of your account, the kind of things that you have faced in speaking out publicly against what the province has done?
I think if you know me, or I entered this field with my heart open to try to give people an inside look at the intensive care unit, because quite clearly the media is not allowed to see the things that we see, and that, I think, is now a problem. As a result, the narrative has changed. The stories are different, and people honestly believe that this isn't a problem because we've had political factions form. I've been the victim of death threats over this. We've seen our hospital protested by people who call us fascists and Nazis. And this is not where we ever started. I never thought we would get here. I truly believe that the majority of Albertans are good and honest and kind people. But when the minority controls the majority through lawlessness, that's terrorism.
And adding to the political fuel for all of this, you have Maxime Bernier, the leader of the People's Party, referring to Jason Kenney as a despot in a tweet last night for enacting the measures that he has, and suggesting that he'll be there in Alberta this weekend prior to the vote on Monday, and this issue and these issues will be front and center. Again, what does this contribute to where you need to be in Alberta?
Well, this further points us in the wrong direction. We need people to come together over these things. We need people to be vaccinated, to follow these new restrictions, because the challenge about the fourth wave is everyone thought that you get your double vaccine and you get to live your life. We dropped all the health measures. We don't have contact tracing anymore. It was never going to work out that way with such a heterogeneous vaccination. We have northern centers which have as low as 43% vaccinated. We can't have these divisions. We need to come together.
Let me just ask you in conclusion, as the day begins there in Alberta and listening within colleagues in the hospital, probably talking about what the Premier announced last night and the measures now in place, many today, many more taking place on Monday. Is there any degree of hope or optimism that those will have any impact on the kind of crisis situation that you're facing right now?
These measures will eventually work. We need contact tracing to be brought back as well. The problem is this period of time between when they work and the numbers that are coming in. And that is scary. That is honestly scary. We've never been here before.